Okay, the next drug. Cyanocobalamin or vitamin B12. Drug brand name Ascobal. Pregnancy category C. Storage was not listed on the card. Indication, dosage, ADR, drug interaction, contraindications will be discussed. The mechanism of action. Okay, cyanocobalamin is a hematologic agent. What's the brand name? Pregnancy category C. What is it indicated for? Cyanocobalamin is indicated for PFFT, pernicious anemia, folic acid deficiency, fish tapeworm infestation, pancreas and bowel malignancies, and other GI disorders that decreases the absorption of vitamin B12. Oral supplementation of folic acid is usually necessary. What is the maintenance? What is the usual dosage? Maintenance dose is usually 1,000 micrograms per month. Cyanocobalamin and hydroxycobalamin are the only stable forms of vitamin B12. It's given parenterally, IM, or subcutaneous. It's not effective when given as an IV. Dosage forms are gel, solution, and the oral and sublingual dosage forms are available without a prescription. In the gel form, you have 500 micrograms per activation. The solution has 1,000 micrograms per milliliter. That's gel, solution, oral, and sublingual dosage forms. Okay. Adverse drug reactions are headache, infection, pain at the injection site, and dizziness. Drug interactions. What are the drug interactions of cyanocobalamin? So, when cyanocobalamin is given with colchicine or heavy alcohol, it interacts with vitamin B12 in terms of it affects the absorption of vitamin B12. It leads to malabsorption of vitamin B12. Antibiotics. So I discussed C, which is colchicine and heavy alcohol use, and then my A is antibiotic use, which may disrupt folic acid and blood assays, and then ALA would be my contraindications. So these are the drug interactions, C and A, and then ALA represents the contraindications, which will be discussed in the next slide. So contraindications for vitamin B12 would be A, anaphylactic shock, which is a risk upon initiation of therapy, of parenteral therapy. And because of this, the first dose should be given at a clinic. L represents Leber's disease. If the patient has Leber's disease, given vitamin B12 will worsen the condition. And then the final A is a caution with severe megaloblastic anemia. Given a patient who has severe megaloblastic anemia, vitamin B12 will lead to induced hypokalemia. So that's why it's contraindicated. Okay, mechanism of action. It works kind of like folic acid in helping with synthesis of DNA. Other things to know. It's given for pernicious anemia. It requires a lifelong supplementation of parenteral vitamin B12. It's only given as an IM or subcutaneous injection. It's not effective when given intravenously. So, practice time. Brand name, Nascobal, pregnancy category C, storage wasn't given, indication, pernicious anemia, folic acid deficiency, fish tapeworm disease, um, pancreas or bowel malignancies, GI disorders that decrease the amount of vitamin B12 that's available. Usual dosage is 1,000 micrograms per month. 1,000 micrograms per month, and that's this is folic acid, but I'm just using this paper to recite this from memory. So it's given 1,000 micrograms per month. Adverse drug reactions for vitamin B12 is headache, infection, pain at the injection site, and dizziness. Drug interactions for vitamin B12 would be colchicine and heavy alcohol use, which lead to malabsorption of vitamin B12. And then antibiotics would cause would also be another drug interaction with vitamin B12. Contraindications of vitamin B12 would be anaphylactic shock, which is a reason why you should give the first dose at a clinic. L, Leber's disease, and then A, if a patient has severe megaloblastic anemia, they should not. Given vitamin B12 would lead to induced hypokalemia. Contraindications, mnemonic was just ALA, and then mechanism of action was it's used in the synthesis of DNA, and then remind the patient that if it's given for life, in the cases of pernicious anemia, it's given for life. In patients who are just deficient of vitamin B12 due to diet or something that can be corrected, if the correction is made through lifestyle modification, then the patient can be switched to an oral dosage form, as opposed to a parenteral form. Okay, so recall for folic acid. Folic acid, vitamin. It's a vitamin. Brand names: folate, folacin, piteroyl, glutamine acid. Indication: megaloblastic anemia. Usual dosage up to 1 milligram. ADR, rare allergy, drug interactions, sulfasalazine contraceptives, aminosalicylic acid, dihydrofolate reductase inhibitors, specifically trimethoprim and methotrexate, and phenytoin. These will all decrease folic acid. Contraindications for folic acid would be anemia. Pernicious anemia would be a contraindication for folic acid, and severe megaloblastic anemia would be a contraindication for cyanocobalamin. Mechanism of action for folic acid is it's used in the synthesis of thymidylate, maintenance of erythropoiesis, synthesis of purine nucleotides. That's folic acid recall. Guanfacine recall. Reasons why it's given: pregnancy category was B. Folic acid pregnancy category was A. Guanfacine is B. Cyanocobalamin is C.